Hey guys, I'm joined here with Reagan from Altus, who's going to be joining us here on the Brooks Report Live. My name is Adam Brooks. Hey, we have something special coming up for you guys. It's called Doc Talk. It's going to be happening here on the Brooks Report Live occasionally. Reagan, tell us what we have coming up.
Adam, thanks for having us, guys. We're so excited. Like Adam said, be sure you like, subscribe, and share so you guys can stay informed and up to date. We're going to be doing all kinds of good, relevant topics that you guys in the community are asking about. And the great thing about this, Adam, is it's a live Q&A with a real doctor. You guys can hop on live time, ask your question to a real doctor. We're going to be talking about important topics like, COVID, what's going on in the current health system right now in the world. So many things that you guys want to know that you're asking about. We're going to talk about it right here, So thank you, Adam.
Yes, sir. Hey, listen, I want to say this is just another one of those things that Altus does for our community to bring us. And so we thank you guys. Listen, put a 1 in the comments if you're watching this live. Go ahead and do that now and put a 2 if you're watching the recorded version. And don't forget to share this stream. Tag some folks that maybe had some questions you've seen posted on some groups. And, well, they can ask a real doc right here. So thank you, Reagan, for doing this on the Brooks Report Live. We appreciate it. Thank you, guys. Now enjoy.
Hey, Adam, thanks. We love you guys. We love our community. And this is just one more way Altus can give back to you guys. Here we go, guys. Enjoy the show. Doc, what's happening, man? How are you? All right. Let me see if I can hear you.
Hold on.
There you go.
Technology is not always my friend. I guess I muted myself.
There you go.
Hello, everybody. Nice to see everybody again.
Facebook, what's happening? Hey, guys, thanks for joining so much. We got a new COVID topic this week. You guys asked about it, so we're going to talk about it. But before we do, Doc, have you seen the Southwest Airlines, all that stuff going on TV right now?
Wow. Yeah. I think it's like a nice way to kind of put some of this information together. The weather, right?
Right. Hey, check this out. So, which brings me to this. I want to show you guys and you, Doc, real quick, this little snippet that just released a few hours ago.
Tensions are escalating between the Biden administration and Texas Governor Greg Abbott.
So it looks like a few hours ago, they're going to try to pass a new law not to
private businesses from
be able to force this mandate.
Vaccine requirements for workers.
Yeah,
found in violation of the order will be.
So anyway, just kind of interesting because I just saw the Southwest thing, and now today, a few hours ago, I just saw this. So
yeah, I definitely. Politicalness has really no place in medicine. Once you walk through the door of the ER, none of that.
Right.
It's a wonderful profession in that sense. But, it is kind of like a gateway that we're, if we are going to talk about it, like what is really going on today, right?
Right.
We talked when Delta first happened, we didn't know how infectious it was, lowered the age range, right? And it's very strong and it continues to be strong. The only thing is when you have these major surges, for instance, in Lumberton, there's only so many people in the area, right? And we had people vaccinated, we had people not vaccinated. We had a major surge, right? And now in our area, you talk, the right word would be herd immunity, right? I mean, if you think about it, right? Like, so what does it mean for the community? Well, I don't know the exact numbers for Hardin County because, the CDC gives, bigger pictures, right? It's not just Hardin County. But, if you look around at your friends, how many of them have had it, right? So if it's 8 out of 10 people, herd immunity starts somewhere in the 70% range, right? And, in Texas, I actually looked at this. In Texas, we're actually fully vaccinated, only 51.9%. Right. I was actually looking at the CDC before we came to this. There was a New York Times article that showed for the United States in general, 65 and up is 84%, 18 and up is 68%, 12 and up is 66%. Right.
Right.
In Texas, and I'm not normally a numbers guy, but I found this interesting. In Texas, even though we're at 51.9% vaccinated, 88% of 65 and up is vaccinated, and 18 and up is 71%, and then 59% below, right? And so it's like a big gateway of, what is business versus what is health, right? Like, so Southwest, this mandate, right? Like Texas has kind of avoided all mandates since the beginning of COVID, right? Like we kind of opened a little sooner, we did everything a little bit sooner. And it goes to what I've always said, like the best thing, of course, is the natural immunity, right? I mean, there's nothing better than you getting COVID and having zero symptoms, right? And, having no issues. But we got to the point where if you got COVID and you got symptoms, man, death was really, knocking on your doorstep, right? So probably the best thing that I would have thought for myself to avoid that problem would have been the vaccine. And now when you have these types of numbers, you see these really extreme rules that are being applied to travel. But, I look at it as, Southwest maybe is more local airline, but when you think of like how global the world is, I mean, there's millions of people coming in from Asia and everywhere that we don't know their vaccine status, right? So I think when you look at it, it looks ugly on a personal level, but I think overall, there's some reasoning behind it. I just think the implementation of a lot of this stuff is just extreme, right?
Right.
That's my sense. Trying to be good about it. Yeah.
No, it's just funny. It's different. Something every day. Something different. Something changing. That's what I wanted to show everybody. For minutes, things are changing.
It's not even just that. I mean, you see it, with schools, right? Like, the teachers are not showing up, or FedEx, or it's all over, right? I mean, employees everywhere are having this issue, and I think it's important. I mean, so even though I say natural immunity is the best, right? Unfortunately, it has no place in politics. You can't really show a test that you were positive, and it helps you with anything they're asking for. They're really asking for the vaccine card, and I think it's important to talk about that, right? Like, say you did get COVID and you just got over it 2 weeks ago or 3 weeks ago. It's also not even time for you to get vaccinated. Like, you still have to wait, right? Like, it's a minimum of 30 days post-COVID for you to wait to get your first shot.
Right, yeah, you got to wait, right.
Right, and so there's things that you could hypothetically miss out on, even though you went through the process of COVID, you were positive, and it's not 100% science-based. I mean, I'll be honest with that, right? Like, I mean, like I said, the best thing is natural immunity, and it doesn't have a place in what they're asking for your job or travel or whatever else they can think of, right? So I think it's important that we know after COVID, right? It's 30 days minimum, right? And you have to get the full 2 doses. I mean, I was looking up at the CDC and also the government mandates. The only thing that really fits the passport if you live in somewhere like California is the vaccine. It's not getting over COVID, which is interesting, right? I mean,
so the other day I was just curious because, I've had COVID and I've had both Moderna vaccines. I was curious what it would show my levels would be at. So I got my blood taken and it says greater than 2,500. I think that was the cutoff, 2,500. So I don't mean to brag, but I feel like I'm doing pretty good right now.
Top 1%.
Hey, because Rochelle, who works at our facility, she only I think had around 1,000. So I guess
so. That'll draw into why the booster, right? So so you had COVID how long ago?
Around last December. So it's been almost.
Okay.
Yeah.
And then the vaccines, the last one was when?
The vaccine, the end of August, so August 30th.
So recent, right?
Right.
So
Yeah, very soon.
I mean, so because it's an mRNA virus, right? We don't really know how long these antibodies go for. We know that we have them,
right?
But it's not really something that you store in high volume, right? So what happens is when we first started talking about it, we always said, "Hey, when are we going to need to do this again?" Well, we thought that if enough people got it, that we would eradicate COVID-19, but obviously that wasn't the case. We never appreciated this type of spread, right? But always a year was like on the target range, right? Because it's not like hepatitis, right? Like hepatitis B, you go in and you got your childhood, vaccines, and we can do a titer and say, hey, I'm going to go to a place where Hep B is prevalent. You do a titer and it says, all right, well, you need 500 million to be, immune. Well, those stay long term. They stay in your body long term. The mRNA ones don't, right? So 2,500 is a very modest number. I mean, it's very low in my opinion, right? Like, it's not like saying, oh, wow, I have a ton. I mean, so we're finally getting into the lab test of even existing of a titer. It was either positive or negative, right? Like, it's been like maybe a month since those are out. So, you know, it's not like having 1 million of them or 500,000 of them. So
I shouldn't be super excited right now.
I mean, I think you should be excited, but yeah, it's you know, it's more of time. I mean, it's anywhere between 8 to 12 months. You have to really consider your factors, and that's what the booster's for, right?
Yeah.
Like, so, you know, the vaccine came out, you know, around January of 2021, right? December, January of 2021. And if you're at the year mark, well, you know, we have these new variants, we have everything, and the vaccines are working. The best thing to do is to get a booster, right? I think the FDA, there's a question from Paula Thompson, the first FDA wouldn't approve the booster, then they did. What changed? I think time changed. I think that they got the data. They saw that the numbers were going down. The CDC followed the titers, and they said, okay, around 8 to 12 months, the numbers are getting lower, right? And immunocompromised people at 8 to 12 months are at 0 or lower, having issues. And I think that's the only thing that changed. I don't think that they ever really changed their mind. I just think they didn't know. Remember, all this is new. None of this is, you know, studied for 20 years, like heart failure or, you know, or even flu for that matter, right? It's forever changing, right?
So the booster has not been approved. Is that right, Doc? It's still not.
It has been approved for certain individuals. It's just not for everybody. Right.
I got you. And I see Moderna is trying to get the approval, you know, right now as well.
Correct. Right now it's just one company, which is Pfizer, I believe. Yeah.
So hey, I saw this thing about the new antiviral drug they're talking about. So tell me, what is that to people watching? What does that do for us?
I had to write it down a few times, just that, and I'm probably still butchering, right? But it's molnupiravir, okay? And not to be confused with like Tamiflu, which is oseltamivir. They're all really hard to say.
Hey, I'm glad you're saying it, not me.
Yeah, exactly. So don't make fun of me. This is actually an interesting medication because so far people have heard of remdesivir, right? And when you talk about a virus, what it does, it gets into a cell and then it replicates, right? And it's multi-steps that it needs. It needs, you know, the first step is just invading the cell. The second step is protein synthesis, and then it starts to replicate. Remdesivir, right, which helped, right? It helped, you know, kind of slow the virus down. And that's always the key word. Whenever anybody talks about remdesivir, it slows the virus down, okay? And it works basically of not allowing it to kind of bind to the area that it needs to, right? And molnupiravir, this new one, it's actually quite interesting. If you think about it, it makes very logical sense for it to work. And it's shown that it's working about 50% risk reduction of death with usage, right? And it works in the second part. And what it does, you know, the body is very interesting that if a cell has an error, right? If the DNA or the RNA has an error, it says, I'm not going to make it, right? I'm not going to make it. So it actually works in the second part of synthesis, right? Of like the protein synthesis, but it puts an error into the genetic code, right? So instead of replicating the virus, it says, oh, no, this is a bad one. Don't make it.
Yeah.
So it still slows the virus in the sense of stopping it, right? It's not 100% effective. But for 50% of the people that were very sick and possible death, right, like ICU patients, it showed 50% risk reduction of death in those individuals, which is obviously very good, right? Like hospitalized patients, 50%, that's an incredible number, right? I mean, most medications like your beta blocker for heart disease are at 5% or 10% reduction.
Okay.
So it's a very high number.
So yeah, I was watching some stuff on it. I guess they're still working on trying to get that one approved as well. I don't guess it's official yet, huh?
Correct. Yeah, they found the study and it made headlines, but it's not officially FDA. It's close. They're asking for it. I imagine that it would be. It is. Oh, so it's all. Remdesivir was for the flu. Right. So the thing is, can you give it for COVID?
Right. So there's a lot of stuff on the horizon. It's just like you say, it's so new. Everything's still so new.
Right. And I think that's what people need to understand. We all need to understand because a lot of these medications didn't just pop up. right? That they're not new. They've been studied. They just not studied for COVID. Now they're studied for COVID. Before they were studied for something else. They were studied for flu, herpes virus, or this virus or that virus. And now we're putting it to the studies of COVID. And that's really where, you know, the people need to understand, like, just like the certain vaccines, mRNA vaccines, you know, were implemented for COVID and found to be effective, but they've been studied for years, right? The FDA approves it for a diagnosis, right? Like, you have to be able to use it for a diagnosis. And that's really what's changing. A lot of these medications that existed, Regeneron, Remdesivir, they were approved for a different diagnosis, and now they're being approved for COVID.
Right. So we're getting there. Charmaine has some questions for you, Doc. Are you ready? Let me put it on the screen here. All right. All about political control. We're not vaccinated and COVID-free, not take vaccines. So, Charmaine, if you're still watching, I'm just curious, why do you feel like you shouldn't take a vaccine? Do you feel like your natural immunity is all you need, or do you think there's something wrong with the vaccine? Let me know if you're still watching. So, all right. So I just asked him your question, so I'm just going to see if you'll respond here. Let's see. She also said a nurse from Baytown says the media is lying. All their COVID patients have been fully vaccinated.
So again, COVID patients we have COVID patients that come into the ER. We do. Okay. But again, the vaccine stops the serious disease, right? So right. Most of the people that I'm diagnosed with the COVID vaccine, right, they're coming in, they have sniffles, right, and they need to get cleared for work, right, but they go home. And right now, the surge of the very sick, like the Delta unvaccinated, it has slowed down. I mean, it's also still summer, right? Like, you know, the winter months tend to be worse for respiratory diseases. So I don't know how to exactly respond to this, but I think some information needs to be filtered in the sense that there's obviously vaccinated patients that do come into the ERs. It's just why they're there, right? Are they there because they need to be on a respirator, or are they there just because they need a clearance for work, right? And
right. There's so many different variables, and I think sometimes, I'm not saying you or the people watching, right, but I think sometimes get misled or misinformation or misconstrued from different sources. Because, you know, we live it every day, and this is not usually, you know, always the case that we see at the hospitals.
And everybody's very on edge, right? Like, so you go to work and you have a little bit of sniffles, right? And, you know, sniffles now, like, we got a bunch of plants after the freeze from different areas. So allergies are really popping right now too, right? Like, so, but people are just worried, right? Is it COVID, right? I have a cough, I have congestion, I have sinus pressure, I have things. So it's you know, a lot of people are going to the ER for various reasons, and people who are proactive and are at work and they are vaccinated, they're being tested more than people who are sitting at home. And so it's kind of what's happening.
Right. So Rhonda wants to know, when can the younger children be able to receive their vaccinations?
So above 12, it's already available. Below that, you know, there's just a lot of back and forth, which I think is rightfully so, right? 5 to 12 is just their ages that at this point, you know, they're not having any issues. So it's, you know, it's kind of like, I'm not exactly sure that I would be gung-ho 5 to 12 vaccinated when they're not having any issues at all with the virus. I just don't necessarily think it's necessary. It kind of goes with what we talked about last time, right? The kids themselves, I'm sure if you did titers on the school kids, I'm pretty sure it's pretty high, but, you know, because they spread it so much between each other and they're not really symptomatic.
Right. So, yeah. So the other day I was curious because, you know, we've all had it. My little girl just had it not too long ago, a few weeks ago. So I'm like, okay, that's everybody. So I checked because he never got sick. It said that he had it within, you know, either the yes or no one. So it said he did have it at some point, but I guess he was asymptomatic. He never showed any fever.
Right. And most kids are like that, right? So that, you know, it kind of goes with it, right? Like, I think there's just so much, right, that's already controversial for people, and adding that age group, I think, would maybe tip a scale, in my opinion, especially when they're asymptomatic. We're just not really having symptomatic kids at that age.
For sure. So let's see. So Shannon just said with 16,000 deaths, okay, permanently disabled. How many deaths will it take to shut down the vaccines? So just curious, Shannon, where did you get these numbers? Because I haven't seen these numbers. Where did you pull this information from? Just curious. Just let me know in the comments where you found this.
I haven't seen that. I know that there was a study that was actively going on of, blood clots within a certain time frame. And I think that was, so they're looking into like heart. So you have to remember COVID, right? When you get a micro dose of the vaccination or you get COVID, there's so many things post COVID. Not even getting into the vaccine, but what it does to your blood, how it makes it thicker, what it does to inflammatory markers, what it does to your lungs. People are having a lot of issues post COVID, right? So they think they're in the clear. 2-3 months go by and either a blood clot comes or they need a heart stent. And it's mostly just because of these complications that I think eventually we'll probably find from COVID, right? And the vaccine is a baby dose of it. So it means you are reacting to COVID in a way, right? So my opinion is still, if you reacted mildly or not at all to the vaccine, it would have been significantly worse if you got the actual virus, right? Like the virus itself would have made anything that you felt or any complication from the vaccine much worse, right? Because your body some people just do not react well to the virus. You can have a couple and they're both active. We've seen it, right? One is asymptomatic and the other is on BiPAP. For the first 48 hours, Shannon, of the deaths and stuff that we're talking about, I have not seen that anywhere. I will have to look at that again, but I don't remember reading it the way you're reading it, at least. I'm not saying you're wrong, but I don't remember.
So Tammy just said she got the first Pfizer shot on August 7th, and then she got COVID on August 13th. When should I get my second shot? Does she need to wait at least 90 days? That's what she's heard.
Oh, you mean for the booster?
She only was able to.
Okay. All right. I got it. So then you got COVID. Okay.
Yeah,
so post-COVID is minimum 30 days. It's minimum 30 days. There's different things that say 30 to 90, but it's minimum of 30 days. I will tell you that within that window, look at your schedule. If you're not going anywhere, you're not doing anything, just, you could, I think if you elongate it, it's almost like the booster, right? If you think about it, right? So you got COVID, you got natural immunity, and you got the vaccine. You can do it as early as 30 days. Let's say you're going somewhere very crowded, like a cruise ship. I would do it before it, right? But if you're not doing anything and it's an open window, then stretch it out to around the 90 days. That way you can, have the immunity longer, if that makes sense. But if you're going to introduce, a lot of people around you, then do it sooner. Do it before that.
So Rhonda has another question. She wants to know, a friend of hers recently passed, put on a ventilator after a negative COVID result while in the ICU. They said his autoimmune due to allergies caused the virus to attack him. So is that possible, Doc, for your autoimmune system to make situation worse?
Well, this touches home with me. I've mentioned that my aunt died of COVID, right? She was in Florida. She was unvaccinated. She passed away from it. She was on the BiPAP for some time. And then, what happens with patients, she was getting restless. She was alone. And she got intubated, and they started to do more imaging because she was intubated, and we started to see a lot of this inflammatory stuff like fibrotic lung tissue, all of a variety of complications with COVID. I think probably what they were trying to say is regardless of testing positive for COVID, that's only for a certain amount of time, right? That you could be positive for 5 days, 7 days, 10 days. But the complications of COVID can go on for weeks or months, right? She spent 63 days, in the hospital before she passed. So being negative for COVID doesn't mean you don't have COVID, right? Like it was in your body and it did the damage. It's just not replicating anymore. And I think that's important to understand.
Right. That's why I guess we see a lot of people talking about long COVID because they're dealing with those effects.
Right, because the lungs haven't repaired themselves. It could take, even a regular pneumonia can take 4 to 6 weeks, let alone COVID. It takes 4 to 6 weeks plus other complications that regular pneumonia doesn't cause, right?
And I think you can even see the damage sometimes on the lungs from an X-ray, right? You can see the scar.
Yeah, you can see it. You can see it for months. And actually, a lot of patients we're finding out that need lung transplants just because they're still winded 6 months later, and they had a lot of fibrotic change and that's an inflammatory marker, like she just mentioned, right? Like it causes, instead of healing the lung with normal tissue, it healed it with scar tissue, and therefore it's just not a functional lung.
So Paula wants to know, is the infusion therapy useful? I think the quicker you do it, the better, right, Doc? The faster
the better, but you have to be positive, right? So it's not like, hey, I'm going to go get an infusion once a week. You have to be positive.
Let's just be on the safe side, okay?
Let's be on the safe side. Go get it. Yeah. So you have to be positive for COVID to have it. You have to have a positive test, and it's very helpful. It's very helpful. Just like this new medication, we don't have it yet, but because the FDA hasn't cleared it. But if you have COVID, go with every arsenal available.
For sure. So Charmaine wants to know, what shot do you recommend for heart patients, since she thinks some of the vaccines, can cause blood clots?
So, I recommend the Moderna or the Pfizer. I personally got the Moderna. Okay. More of availability when I got it in January, not specific. I kind of like the Moderna better because the storage is not as complicated, if that makes sense, as some of these other ones. So I think there's less room for error. But if you're getting it at Walgreens, they're all really well recognized. I think it's more the mom and pop locations that I think the Moderna is the easiest to get.
Right.
The vaccines causing blood clots, be careful with complications that are very minor being stretched to major levels, right? Like if you got a blood clot from the vaccine, you probably would have died from the actual virus. This is a baby dose of it. I think any complication from the vaccine would have been much worse if you got the virus.
Right.
And that's my opinion. And I've been sticking to that the whole time.
So doc, if you are at threat to have a blood clot, could the doctor give you any blood thinner? Do they ever do that?
Yeah, if you're a threat for blood clots, you normally will get on a blood thinner. And that's why you have to talk to your provider. Wherever it is that you're getting it from, talk to your primary care, talk to somebody who's dealing with COVID, like we've talked about before. The best information is coming from people who deal with COVID on a daily basis, not other physicians like that you just know that are friends, right? Make sure that you're dealing with a frontline person. That's the best way. But if you have a risk of blood clots, you're going to get on blood thinner and then get the vaccine.
So you kind of touched on this earlier. Somebody asked, I've got COVID. Why do I need to get the vaccine, do the vaccine mandate? Because I guess the natural immunity. You talk about it all.
We're getting into a realm that's not necessarily, I can't explain it this way for medicine. The best is natural immunity, right? The studies from Israel would say natural immunity is the best. And the best is natural immunity. And after a certain amount of time, you get a vaccine and it reduces the risk of death to almost zero, right? So if you're looking at it at a non-political standpoint, yes, the natural immunity is the best. But when you look at it from a science standpoint, like a physician, how can I protect my patients for the longest, right? And that is natural immunity and then getting the vaccine after, right? So I don't like to think of it as the mandate. I look at it as a physician, how can I protect you the longest?
Long term.
And the antibodies, whether it's natural immunity or whether it's vaccine, they live around 8 to 12 months. So if you get natural immunity, you're positive. We wait, right? Unless there's a significant event closer to the 30 days, you wait 90 days, you get the vaccine. It's shown to reduce the risk to death of almost zero. So so that's the way I want to look at it. I don't want to look at it as like they're telling me what to do. What's unfortunate is in that time frame, right? Let's say the person who was positive is naturally immune, wants to travel somewhere. You're falling into that political world, right? Where you are immune and it's like getting the vaccine. But until you get the card, unfortunately, my methodology may not fit your timeline, if that makes sense.
Right.
The only thing that they look at is the vaccine card, unfortunately.
So Derek just said, remember the oath. Do you have to take an oath like this, Doc, or?
The Hippocratic Oath. I remember it very well. Yeah.
Oh, man. So speaking of all this, political stuff going on, it looks like the deadline is November 24th, I guess, for Texas. But with, Greg Abbott putting this into place, it may eliminate that. I don't know. I think it's going to get interesting. I go on vacation in November, so I'm supposed to go to Florida. So it looks like if things get crazy, I'll be driving. Okay. Even though I've already.
Again, there's natural immunity is the best, right? But how do I protect my patients the longest? It's extending that immune response, right? And that's why I still think the vaccines are good. I think the vaccines are great, actually. And I think the vaccines are necessary. And I think the vaccine also protects your family and the elderly, and and it continues the herd immunity. And the time frame of the studies that we have, because naturally this is only so old, this virus is within 90 days, you start to get the vaccines, and it's been working the best. And I apologize, for other things that are out there, but I think that's the way I want to look at it from the science standpoint.
Right.
That's the best studies that we have right now. If in 6 months they say 6 months, then I'll back that. But we just don't know. I don't know. The studies are not out yet.
And I know you personally, and I see you, at the facility taking care of patients. I know you care about these patients, and you wouldn't do things that you wouldn't do yourself. You've taken the vaccine.
I have. I've taken the booster as well. I actually got my booster September 3rd. So I got my first vaccine January 3rd, and then I got the second one February 1st or 2nd. And then I got my booster on September.
Yeah.
And in between, I got COVID.
Right.
I didn't fall terribly. I didn't need oxygen or anything. But I don't know if it was my kid or someone from the hospital. But I got COVID in between that, and I still got the vaccine. So it's almost like the hair club for men. I'm not only the president, I'm also a client.
Yeah, and I know you love, you love your patients. I see how involved you are. Your heart's in it. I've seen you fight to keep people alive. So I know this is not just a political thing for you. I know you really believe, So
I mean, there's no place for politics in the emergency room.
Right.
I swear it. It's just I know that the people have the same questions as how do I relate the science to what's going on, and I hope I've done okay with that, because the reality is that the best information we have is up to 90 days post-COVID, get the vaccine. Do I agree with all of the little things, like you need, if you want to get a cup of coffee in San Francisco, you need a vaccine card? Well, it's kind of tricky, right? Because I just got over COVID a month ago, right?
Right.
But that doesn't help you because you can't show that, right?
Yeah, it's sad because there has been misinformation, and you just did a CBS special on this. Guys, if you didn't know, if you didn't know, Dr. Goffi's famous. He's famous now.
Be grateful we live in Texas. You have Abbott, I think he's trying to go with the best information we have. Right. There's factors that can change with time. Like I said, if the studies come out and they say after COVID it's 6 months, then you're going to hear it first from me as soon as I read it. I mean, that
right.
Right now it's up to 90 days. Yeah. Right, start at 30 and go to 90.
So what was that show called that you were on CBS? It was
CBS Morning Show, national TV. They filmed for like a few hours and only showed a little bit part of me.
I know. I stopped. I'm like, I had to rewind it. It was just a little small clip, but hey, it was cool. Man. It was cool.
Yeah, it was kind of incredible. I was very proud to represent, Altus, Altus Emergency, and it was very surreal to say the least. So just representing everybody and locally, and we continue to do it locally with you guys. I always like the questions. I like everything. I like being here for you guys. I hope it's informative and effective.
So Doc, thanks for stopping in today, talking to us about the boosters, the new antiviral drug coming out. I appreciate it, man. Guys, remember, we're here at all of our Altus facilities 24/7. I mean, all emergencies all the time. And the best thing is, if you're not sure, come in. We got free medical screening.
Yeah, we have free medical screening and doctors that are willing to talk to you and answer your questions, for anything that you could need, okay? It's our pleasure to serve the community.
Hey, Doc. Hey, we'll see you next time, guys. We usually do this every other week, so we won't see you next week, but we'll see you the following week. So if you have anything you want us to talk about, comment below, like the page, share it, and guys, we'll see you next time on Doc Talk. Thank you guys for tuning in.